finally infertility definitively can affect someone's relationship with God. And this is something that I didn't want to touch. I've been running mind-body groups for years and years and years, and patients would bring up God in the context of, God's punishing me, why won't God answer my prayers? And I thought, I'm a psychologist. We never had a course in how to talk about God with your patients. But a number of years ago, I had a new intern who, at that point, was in her 60s. But when she was in her 40s, she had become an Episcopalian minister. And so a funny thing about Episcopalian ministers is that they want to talk about God a lot. And so she was doing my groups with me for 2 years and wouldn't stop talking about God. But the patients really liked it. And in fact, we ended up having to offer extra seminars that she would come in and lead to talk about, what's God got to do with it? How does God interact with a couple's feelings about their infertility? And, she sat down and talked to a lot of patients, and what they said was, this is the first time God hasn't answered my prayers. Why is it that I'm a good person and I go to church once a week and, I've never done anything evil, I've never killed anybody, I've never done drugs, I've been a good person and I'm not getting pregnant, and the 14-year-old crack addict is. Why does God think that's fair? And so you have individuals or couples who are not just in an infertility crisis, but it puts them in a spiritual crisis as well. I had a patient recently who lost a baby and was devastated, obviously, and said that her husband had come home and said, I figured out, I know why this baby died. It's because they had gotten pregnant when she was in college and they chose together for her to have an abortion. And he said, see, this is what happens. You have an abortion and then God takes a baby away from you. And, I tried to explain to them in every rational way I could that that's not why she had a miscarriage. But that's what they think. And so I think we have to start addressing these issues. 80% of people in this country believe in God and pray. And in fact, if you ask patients, a lot of them wish their physician would offer to pray with them, which, may not fly in New York, but might be very popular in other parts of the country. And I think that people have to start addressing the issue of God and punishment. When Barbara Nielsen, my intern, was working with patients, they would always say to her, why isn't God answering my prayers? This is the first time in my life that God is not answering my prayers. And she would say to them, well, you keep on praying to God, but do you ever stop and wait and listen for his answer? And sometimes patients say, you know what? No. And maybe there is an answer. And what's really mystical or whatever is almost every patient in my entire career who has adopted or done egg donation has said to me, now I understand. God did have a plan. This was the baby that I was meant to have. And there seems to be a psychic connection, no matter how you get your baby, that this was the baby you were meant to have. And so I think, I was surprised, but I think what you actually see is the more religious patients have an easier time with their infertility because they do believe God has a plan. And so, if somebody has sort of lost the faith of their childhood or their youth, I'm not saying go back to that faith, but maybe you should explore different faiths and find one that may provide some comfort for you. What's really odd is that, officially the Catholic Church is against in vitro fertilization. And that's the decree of the Catholic Church. And yet we did a little survey in Boston, and about 75 or 80% of the Catholic priests tell their practitioners to follow their need. If you need to do IVF to have a baby, you need to do IVF to have a baby. And there was a study presented at the fertility meetings a few years ago from South America, which is mostly Catholic. And they asked patients, was your decision to do IVF at all influenced by your Catholicism? And the answer was no. These patients want a baby. No matter what the church says, the vast majority of patients seem to be pursuing treatment despite that decree. It shows the drive to have a baby, that someone's willing to go against their faith. The problem comes in is if they don't get pregnant or if the pregnancy goes sour. Then they think, see, I shouldn't have done in vitro. See, God's punishing me. And I've had some really interesting conversations with patients about the whole interrelationship. And I've actually said, I had a patient once who had a miscarriage, and she said, see, God's punishing me. If I hadn't had an abortion in college, I wouldn't have had this baby. I wouldn't have miscarried this baby. And I said, do you really think that's how God works? I said, do you really think God kills babies? And she said, of course not. God doesn't kill babies. But that's what you're thinking. I said, I know a lot of people were brought up to believe there's a punitive God, but I don't think God kills babies. And she actually agreed with that. She said, you know what? You're right. If you use sort of rational thought, you may not believe it. About 5 years ago, the Boston Globe did a cover story on their Sunday magazine on religion and infertility. And they interviewed, a rabbi and a priest and a minister about that. And in fact, there's a lot of thinking about what is the interrelationship. And there's actually a course that's going to be offered in Boston this fall on the interrelationship between Judaism and infertility. Because if you think about it, the Orthodox faith, those families tend to have huge numbers of children. And what happens about an Orthodox couple who's infertile? I mean, how do they feel going to synagogue and seeing families that have 8, 10, 12 children? And they must feel very left out of that community. One of the hardest things is when treatment fails. It's not that common to have a definitive endpoint. I mean, for some couples, they run out of money. And, that's a definitive endpoint. It's relatively rare for a physician to say, you cannot go on. I mean, yeah, a high FSH level or poor response to medication, or, if you've done as many IVF cycles as your insurance will cover, that might feel like a big endpoint right there. It often comes to the couple to decide when they are going to stop. I mean, a part of me wishes that physicians would be more definitive. I mean, there's certainly programs around the country that are much more selective about who they cycle. Anybody whose FSH is above a certain point, or whose age is above a certain point, or who's done a certain number of cycles is ineligible. And then a lot of patients will just go to a different program. I mean, in Boston, of I think 6 programs here, I can tell you exactly who is the most selective and who's the least selective in terms of who they cycle. And so it's not that common for a couple to be told, for sure, you cannot go on. I mean, if a woman's FSH level is high, they'll be sort of steered towards egg donation. So it's hard to talk about when treatment fails because there aren't that many definitive endpoints. But when the couple has come to the point where it doesn't make sense to continue trying with her eggs and his sperm, that's hard. There's no question. It can be brutal. Easier perhaps if they've done a lot of treatment because then the idea sort of slowly sinks in. I think the hardest cases I see is a couple who are just starting to try. They go see their physician. She has some blood work done and her FSH level's high. And the physician says, look, I'm sorry, we're not going to treat you. There's nothing we can do. And then they go basically from trying to endpoint immediately. Most couples end up going through multiple treatment cycles, multiple failures, and so the endpoint's not that big a surprise. It's a disappointment, but it's not that big a surprise. And that's why I tell my patients from day one, have a plan B. It's interesting, I talked to a couple the other day who had done their first IVF cycle that just did not go well. She's what they call a poor responder, where, she's on high doses of medications, only produce a couple of eggs, and they didn't look so great, not such great embryos. And so they've decided to try another IVF cycle, and I did a phone consult with them because they live out of state. And I brought up egg donation, and no one had ever mentioned it to them. I mean, for them, it was either one more IVF cycle or adoption. And, I think that people have to think there are other options out there. And, if a couple wants to, or anybody wants to be a parent, they're going to be a parent. There are lots of options out there. And so when treatment fails is really more when you get to the point where you're not going to have a child that's genetically related to both of you. And that's what it means. It does not mean you're not going to be a parent. It does not mean she's not going to be pregnant. It does not mean you're not going to be a family. It just means that the fantasies you've had of the baby with his nose and your eyes, that dies. That dream does die. And that's very painful. There's no question. I see miracles almost every day. I mean, what's amazing to me is you have all this data on high FSH levels, horrible male factor, age, everything else, but I could just sit here and tell you all the patients of mine in the last year who defied the odds. I mean, women who have FSH levels of 45 who get pregnant spontaneously. Women who've gotten pregnant. I have a patient who got pregnant on her 13th IVF cycle and has a beautiful little girl. So that's the hard thing is I see miracles every day. And so I can never say to a patient, you will never get pregnant. Because you know what? There's no never. I have a patient who spontaneously conceived at 48 after 10 years of infertility, and she has the most gorgeous little boy you've ever seen. So you can't ever say never. But if you want to become a family sooner rather than later, you might need to make other choices. I mean, one thing I'll say to patients all the time is, you know what? Right now what we have available to you doesn't seem to be working. Maybe it makes sense to move on to adoption or egg donation or whatever, which gives you so much a better chance of having a baby. In a couple of years, you can revisit and see if the technology has improved. I mean, PGD, pre-implantation genetic diagnosis. Maybe in a couple of years, it will get to the point where it really can give new hope to couples. We don't know. But, you know, it depends how hard you're driving yourself to have that genetic child versus how hard you're driving yourself to build a family. And I think one of the things I see in every mind-body group is people realizing, you know what? I want to be a mom or a dad. I don't necessarily have to pass on my genes. And that's a really important point. You know, every couple I've ever seen has heard, just relax and you'll get pregnant, just adopt and you'll get pregnant, have a glass of wine, go on vacation, don't try so hard, try a different position, whatever it is. And what it all comes down to is you're doing something wrong. If you would only do it the way I'm telling you to do it, you'd get pregnant. So it's your fault, you're causing your infertility. I mean, that's inane. I mean, if you look at all the medical treatments out there for infertility, no. Just relaxing is not going to cause a baby. Just adopting is not going to cause a baby. That's not how it works. Infertility is a medical condition. And it just inflames me to hear all the comments, all the hurtful things that my patients have to hear on a daily basis. I mean, I moderate a website on INSID on emotional issues, and so I posted one day and said, you know what, I'm going to write snappy comeback lines that you all can use. Can you give me, you know, I'll come up with all the situations. And so the people were like, it was like a flood of responses. And so now I give out to my patients snappy comeback lines. So when someone says to you, just to relax and you'll get pregnant, there's a choice of about 6 answers, ranging from the very thoughtful, careful, educational approach to singing them back. I mean, you can't blame somebody for their infertility. It's a medical condition. I mean, it's just like saying to somebody, just to relax and your cancer will go away. I mean, you know how insulting that is? Infertility is not a voluntary condition. I mean, it's by far the opposite. If you look at the time and effort and money and energy the victims of infertility expend to try to cure their infertility, it's not fair to tell them that this is a voluntary condition. It's not. It's very rare to have infertility for psychological reasons. It's almost always medical causes. I think for a man to hear the infertility is caused by male factor, it can almost be more painful than for women to find out it's female factor. Because I think for guys, they tie in the ability to get their wife pregnant with virility and masculinity and being a man. And if they're told their sperm is substandard, it affects who they are. And at some level, I think maybe it's easier for women. I mean, I've had so many female patients say to me, oh, I wish it had been me. It's killing me to watch him feel so bad about this. And you know, one of the issues there is, in most cases, if it's a severe male factor, they treat her. They put her through an IVF cycle, and they do ICSI, which is where they inject one sperm into an egg. And so at some level, they're overcompensating by making her more fertile to compensate for his subfertility or his infertility. And so what you have there is enormous guilt on his part. I mean, if you think men feel bad about giving their wives injections when it's a female factor problem, think how a man feels where it's his sperm that are substandard and he's having to give his wife 2 or 3 shots a day and see her go through surgery to compensate for his infertility. It's awful. He tends to feel very guilty. You know, in cases where the husband is really supportive, it tends to be fine. But in cases where the husband isn't supported, that's not okay. I mean, again, it makes her feel like she's doing everything to try to build a family. She's going through all this because of him, and he's not holding up his, you know, part of the deal. And so that's when you get a lot of couples issues coming up. It's rare, but it happens. I think what I want people to understand is they're not alone. I mean, as you watch this DVD, you might be thinking, you know, I'm alone in that. Or maybe before you start watching this, that you're totally alone and that you're crazy and that you have these crazy thoughts, and you're not alone. I mean, there are 10 million people in this country alone who are going through infertility, and there is so much out there that can help you. There's so much you can do yourself to help you feel better. There's so many things out there that are going to help you, and you will get healthy again. I mean, infertility is not permanent. I think one of the best studies I ever saw was one by a researcher in Canada who somehow found women in their 60s and 70s who had gone through infertility when they were much younger, and a third of them had had biological children, a third had adopted, and a third had never had children. And they were all equivalent psychologically. So as awful as this feels right now, it's not going to have a permanent impact on your mental health. You are going to get over this. Infertility is a temporary crisis.